The drugs and alcohol crisis in America, understanding the epidemic and seeking solutions. The United States is facing a severe drugs and alcohol crisis that has far-reaching consequences for individuals, families, and communities. This epidemic, fueled by various factors, has led to an alarming increase in addiction, overdoses, and related health problems. Understanding the root causes, effects, and potential solutions to this crisis is crucial for addressing it effectively. The scope of the crisis. The drugs and alcohol crisis in America is multifaceted and pervasive. According to the National Institute on Drug Abuse, NIDA, millions of Americans struggle with substance use disorders, SUDs, including those related to alcohol, prescription medications, and illicit drugs. The opioid epidemic, in particular, has garnered significant attention due to its devastating impact. In 2019, nearly 50,000 people in the U.S. died from opioid overdoses, a number that has only continued to rise. Causes of the epidemic. Several factors contribute to the drugs and alcohol crisis in America. Prescription practices. The overprescription of opioid painkillers in the late 1990s and early 2000s played a significant role in the opioid epidemic. Patients who became dependent on these medications often turned to illicit drugs like heroin and fentanyl when prescriptions were no longer available. Economic and social stressors. Economic instability, unemployment, and social isolation can increase the risk of substance abuse. Communities with high levels of poverty and limited access to healthcare are particularly vulnerable. Mental health issues. There is a strong link between mental health disorders and substance abuse. Individuals with conditions such as depression, anxiety, and PTSD are more likely to turn to drugs and alcohol as a coping mechanism. Accessibility of substances. The availability of drugs and alcohol, whether through legal or illegal means, contributes to the prevalence of substance abuse. The rise of synthetic opioids like fentanyl, which are significantly more potent than heroin, has exacerbated the crisis. Effects on individuals and society. The impact of the drugs and alcohol crisis is profound and widespread. Health consequences. Substance abuse leads to numerous health issues, including liver disease, heart problems, respiratory issues, and infectious diseases like HIV/AIDS and hepatitis C. Overdoses, often fatal, are a tragic consequence of this crisis. Economic costs. The economic burden of substance abuse in the U.S. is staggering, costing hundreds of billions of dollars annually in healthcare expenses, lost productivity, and criminal justice costs. Family and community impact. Substance abuse strains families and communities, leading to broken relationships, child neglect, and increased crime rates. The emotional toll on families dealing with addiction can be devastating. Stigma and barriers to treatment. The stigma surrounding addiction often prevents individuals from seeking help. Additionally, there are significant barriers to accessing effective treatment, including a lack of healthcare coverage, inadequate treatment facilities, and insufficient funding for addiction services. Addressing the crisis. Tackling the drugs and alcohol crisis requires a comprehensive and multifaceted approach. Prevention and education. Prevention programs that educate young people about the dangers of substance abuse are crucial. Schools, communities, and healthcare providers should work together to raise awareness and provide resources for early intervention. Treatment and recovery services. Expanding access to treatment and recovery services is essential. This includes increasing the availability of medication-assisted treatment, MAT, which combines behavioral therapy and medications to treat substance use disorders. Mental health support. Addressing the underlying mental health issues that often accompany substance abuse is critical. Integrated care models that provide both mental health and addiction services can improve outcomes for individuals struggling with both conditions. Policy and regulation. Implementing and enforcing policies that regulate the prescription and distribution of opioids can help reduce misuse. Additionally, decriminalizing certain substances and focusing on treatment rather than punishment for nonviolent drug offenses can reduce the stigma and barriers to seeking help. Community engagement. Communities play a vital role in addressing the crisis. Local initiatives that provide support and resources for individuals and families affected by substance abuse can create a network of care and reduce the isolation that often accompanies addiction. Innovative solutions and success stories. While the crisis remains severe, there are innovative solutions and success stories that offer hope. Harm reduction programs. Harm reduction strategies, such as needle exchange programs and supervised injection sites, have been effective in reducing the spread of infectious diseases and preventing overdoses. These programs provide a safe environment for individuals to use substances and access healthcare services. Peer support networks. Peer support groups, such as Alcoholics Anonymous, AA, and Narcotics Anonymous, NA, offer a sense of community and accountability for individuals in recovery. These networks can be a lifeline for those struggling with addiction. Telehealth services. The expansion of telehealth services has increased access to treatment for individuals in remote or underserved areas. Virtual counseling and support groups provide a convenient and confidential way for people to seek help. Community-based initiatives. Many communities have launched successful initiatives to combat substance abuse. For example, the Gloucester Police Department in Massachusetts implemented the Angel program, which encourages individuals struggling with addiction to seek help at the police station without fear of arrest. This program has connected hundreds of people with treatment services. Legislative actions. Recent legislative actions, such as the Support for Patients and Communities Act, aim to address the opioid crisis through comprehensive measures, including improved access to treatment, better prescription monitoring, and enhanced support for recovery programs. Conclusion. The drugs and alcohol crisis in America is a complex and multifaceted issue that requires a coordinated and compassionate response. By addressing the root causes, expanding access to treatment, and supporting prevention and education efforts, we can make progress in combating this epidemic. It is essential to reduce the stigma surrounding addiction and provide comprehensive care that addresses both substance use disorders and the underlying mental health issues. Through community engagement, innovative solutions, and policy reforms, we can create a safer, healthier future for individuals and families affected by substance abuse. Thank you for watching. Please subscribe, like, and share. Send suggestions to nursetolukinkogmail.com.